A very good afternoon, one and all. I am Dr. Praveen Kumar Patil, a lecturer in School of Dentistry. And today, for today's live session for adapting to the next normal at IMU School of Dentistry. This is a live question and answer session with Professor Seow Liang. Before I call upon Prof. Seow, without wasting any time, I welcome Professor Seow Liang, Dean of School of Dentistry, for this live question and session on the adapting to the next normal at IMU School of Dentistry. Prof. Seow, over to you.
Thank you very much, Dr. Praveen. A very good afternoon to everybody here. First of all, I would like to thank you for spending your precious Sunday with us to get to know more on the dental program in IMU. So as mentioned, I'm Liang Lin. I'm currently the Dean at the School of Dentistry. And for the next 45 minutes or so, I will talk you through what we have done for the past 18 months in IMU for the dental program. And we also would have a Q&A session as well. So feel free to either unmute yourself and chat with us or put your questions in the Q&A panel. Yeah, so for the undergraduate dental program, it's a two-phase program. First phase will be 2.5 years, entirely conducted at IMU Bukit Jalil campus. And for phase 2, we have two different tracks. You can choose either to spend the rest of the 2.5 years with us, or you can choose to spend 2.5 years with one of our partner dental schools. At this point in time, we have 5 partner dental schools, i.e. the Dundee, University of Dundee in United Kingdom, University of Glasgow in United Kingdom, University of Adelaide in Australia, University of Otago, New Zealand, and also University of Dalhousie in Canada. All these are top-notch, world-renowned universities. If you choose to go to our IMU Partner School track, you will spend the second half of the program in this respective university and receive a dental degree from these universities. And besides the undergraduate program, we also have started the postgraduate programs as well. We have 3 postgraduate programs at the moment. We have postgraduate diploma in implant dentistry, which has started 5 years ago, and we have also obtained another re-accreditation for additional 5 years. So I would like to add, these postgraduate diploma programs are all accredited by Malaysian Qualification Agency. That means the quality assurance is in place. So it's closely monitored by the university and also the Malaysian Qualification Agency as well. This year, we have also rolled out 2 other postgraduate diploma programs as well. Postgraduate diploma in endodontics and prosthodontics. So for our alumni who have gone through our IMU undergraduate program, if they were to decide to come on and pursue their postgraduate study with us, they will enjoy a certain amount of discounts when they come on board with us. So for the learning of a student, there is 3 main learning domains that we can broadly categorize. There is learning of knowledge, your critical thinking skills and problem-solving skills, and also learning of skills. For dental program, the practical skills and the clinical skill is of utmost importance. And also to provide good patient care, communication skills is also very important as well. To be a good dentist, we need to also inculcate certain characteristics. So the learning is in the affective domain. So we put a lot of emphasis on the interpersonal growth of our students to inculcate professionalism and empathy, compassionate, and to be able to be a good listeners. So this is under the attitude of our students, which we put a lot of emphasis on, because to be a safe, effective, and a caring dentist is very important, not to only have a clinical skills, but also be a very empathetic and compassionate person as well. For knowledge learning, even before the pandemic, we have already put in place different strategies to help students learn, to give support to students. So we have very comprehensive e-learning portal where the lecturers will deposit the resources like the lectures, presentation, other resources, the journals, the articles that is relevant to their learning. We have also invested a lot on giving access to the students for various scientific journal portals as well. So these are all packed under the e-learning resources where the learning can be asynchronous. Asynchronous meaning to say the students can access all these resources anytime, anywhere, to be personalized to cater to their needs. So when pandemic happened last year, very quickly, we put out our e-learning platform to ensure that the students' learning are not affected at all. So this is what we call synchronous teaching, meaning to say it's a real-time teaching. So the lecturers will give lecture through Teams platform. The students learn together at the same time on a real time. So they can give questions to the lecturers and get answered there and then, to have good interactions with the lecturers. So we put a lot of emphasis on synchronous and also non-synchronous platform to support our students. So apart from these two formal learning portal, we also have a mentor-mentee system as well. Especially during the pandemic, the mentor is constantly in touch with their mentee, i.e. the students. So we have very frequent mentor-mentee meetings online, and we also have regular engagement sessions with the student representative. For example, we have a lot of dean's briefing sessions. We also have a lot of staff-student meeting to listen to the students on their needs. We also have swapped some of our teaching and learning activities as well to ensure that the students' learning is not adversely impacted. For example, those learning that is more on knowledge-based, we quickly deliver it through our online platform. The ones that for practical skills learning, we will push it a bit back to wait until it's safe for the students to come back, applying the MOE's, the Ministry of Education's guideline that we can bring students back, then they will continue to learn their practical and clinical skills. So this is to ensure that the students' learning is not impacted in terms of time, so they are able to graduate on time as well. So with this, we also have put in place a lot of practical skills videos as well. So we have, all the lecturers have recorded a lot of practical skills video, play it online for the students and explain to the students so that they have an idea what they are going to do when they come back to us in the campus. So they can replay and review the videos that has been played for them. And also I would like to add on, for all the synchronous teaching, the sessions are all recorded. So it's a very good resource for the students to do revision. If during the class, if they miss something, they can always replay back this recording to ensure that they understand. And with that, there's also a portal for them to chat with the lecturers as well. They can always post it up in a chat during that particular sessions to engage with the lecturers as well. And for practical and clinical skills training, we put a lot of emphasis on student and patient safety. So we have our infection protocol that is strictly guided by the Center for Disease Control and also MOH. Yeah, so we don't want to have any adverse event to happen in our clinic. So this is our clinic prior to pandemic, a very open space plan that encourage collaborative learning. And with the pandemic now, we have converted all these cubicles into what we call AGP base for aerosol generating procedures. Because when the students treat patients, there is a lot of aerosols being generated. So this AGP bay is a very specialized engineered unit where all the aerosols are being sucked up by a special suction unit to go up to the central sterilization facilities. We have put in several HEPA filters and also UV light sterilization unit in the central sterilizing unit, so that the air gets through all this before they get circulated back to the clinic. So this is our simulation facilities where the students start the preclinical training. They need to have the skills first prior to treating patients. So even in the preclinical unit, we are ensuring student safety by wearing goggles, face masks, gloves, and also clean lab coats as well. So this is in adherence to the guidelines set out by CDC and MOH as well. So in the affective domain, prior to the pandemic, our students have a lot of community engagement sessions. Like I mentioned before, to be a good and compassionate dentist, the students need to develop interpersonally, to have the empathetic element, to be professional as well. So we have a lot of such community engagement sessions for students to grow. However, with the pandemic, they are not able to do that, but we quickly converted all these community engagement sessions to a virtual platform so that the students can still learn and the students can still continue to inculcate their empathetic behavior, to be a compassionate person, to know how to deal with all this community in a professional manner. We have also put in role play sessions with simulated patients so that they know how to communicate with their patient as well. So this is to promote interpersonal growth for our students. So of course, the whole program needs to come with the assessment as well. We need to ensure that students have learned what we want them to learn. They have achieved the learning outcomes for the program. So with the pandemic, again, we have also converted our assessment to online as well. This is not difficult for us to do because prior to the pandemic, we have already got our online assessment system in place for the past 3 years. So it's not new to us anymore. We are very well experienced in doing so. So in order for students to conduct all this professional assessment online, for every assessment, we will conduct one mock assessment for them first to ensure that they do not have issue in logging in. They are well versed with the logging in system. So for the assessment, we have put in both open book and also closed book assessment. Open book assessment normally is given for a period of time. For example, they can submit the assignment in 3 or 4 days time so that they can refer to whatever material they have. This is to inculcate their critical thinking skills and also problem solving skills. It's not really directly just vomit out whatever textbook has given you. So they need to know first where to find resources to do the assignment, and next to apply to the scenario that has been given to them. So this is a very good training ground for them to be able to solve a problem that is given to them. So that's given under open book assessment. We also have closed book assessment as well. Closed book assessment for the professional exam are all done being proctored, meaning to say, even though the students are doing assessment at home, they will have a device that will be able to record themselves to make sure that the professionalism is being observed. So, and we also have a no detriment policy as well, meaning to say in the event that students have internet issue, when they have problem logging into the assessment portal, they will not be penalized for that. They will be given equal amount of time with as with other students to make sure that they are able to answer all the questions in the assessment. And as I mentioned before, we have 2 tracks. One track is to complete the whole dental program with IMU. The other track is to have the students 2.5 years with us and the other 2.5 or 3 years in one of our partner schools. So during the past 1.5 year or so, with the travel restrictions being kicked in, there's a lot of issues with applying visa and all that. So we do have a dedicated international office. Again, this international office is not new. We have been having international office for a long time because of our track record of having partner schools in the medical program and also dental program. So the staff that are very, very experienced. And we also have constant engagement sessions with the dean or our partner dental schools as well. And to ensure that our students' learning is not impacted and they are able to transfer to our partner school. For example, last year, we do have students that managed to get a student visa approved and transfer to UK. And this year as well, we do have students who are able to transfer to Dalhousie in Canada and also University of Dundee in UK. So that their learning is not impacted, they can continue with our partner dental schools. So the international office assists the students in the visa application to ensure a smooth transfer to the partner schools. So with this, I would like to thank you for your patience in listening and spending your Sunday with us. So I would like to open the floor for questioning if you would like to know a little bit more about the dental program in IMU.
Yeah, thank you so much, Prof. Seow, for such an quick and elaborative session for about the School of Dentistry and what really School of Dentistry is doing, especially towards tackling this difficult pandemic situation and adapting towards the new next normal situations. Thank you so much for elaborating in a pictorial form. I would rather say School of Dentistry has given a bit way beyond developing some AGP rooms, which will be the topmost quality control in terms of infection control in this pandemic situation, and also the conducting the exams and a lot more things to talk on. Let's take couple of questions which participants are already have put it in a Q&A chat box. So, Prof, first question is there any scholarship for undergraduate dentistry? Yeah, could be probably a potential student question, I think. Yeah.
Yes, thank you very much for the question. At this point in time, there is no scholarship for dentistry from IMU. However, we do have a special bursar that you can apply to. And on top of that, there is also other scholarships available as well. For example, JPA, they do give scholarships to come to IMU. So for next year, JPA has allocated 25 places for scholarship for students to apply. So if they get the JPA scholarships, they can apply to IMU if they would like to.
Right. Okay. Thank you so much for. I think the participant has got the answer. So we have another question about from another attendee is, in what semester will the students start to do the practical or clinical sessions in dentistry?
Okay, again, thank you for the questions. In IMU, our dental program emphasizes a lot on early clinical exposure as compared to other more traditional dental program. So our students will start to do practical very early on, from year 1 onwards. Traditionally, normally in other schools, they do it on year 2 onwards. In practical, that means what we call a preclinical sessions. So from year 2 onwards, they will do preclinical sessions. From year 3, then only they will go to clinic to start treating patients. But for our dental program, we emphasize on early clinical exposure. So from year 1 onwards, they already start to do practical. So at the end of year or the middle of year 2 onwards, they are starting to treat patients already in the clinic, well supported by our experienced clinical supervisors. So this is for them to have very adequate time to be familiarized with the clinical setting, to achieve the competencies that is required by our dental program.
Right. Yes. Rightly said by Prof. Seow. Early clinical exposure is a key in dentistry, and that's what exactly we are doing, so that at the first year or second year of a new things, the students can correlate what's happening, what exactly am I doing in sense of a clinical practice in that relevant aspect. Thank you so much, Prof, for answering this question. I'll take the next question. Is a requirement to pass SPM Sejara in order to apply to IMU for dentistry?
For sejarah, I think in general rule, it is a must-pass subject. It's not more, so specific that you need to have sejarah to apply for a dental program in IMU. But in general, there is the Malaysian government rule that you need to pass your SPM sejarah to get a full SPM cert. Yeah,
Okay.
but for our dental program, we do have specific requirement to be able to apply to us. So we do have a chat room later. You can speak to the counselor more in specific for our entry requirement for dental program.
Right. Okay. Thank you, Prof. So another question is, if graduated from IMU, which country's dental council recognize the degree of dental surgery?
Okay.
Yeah.
Yeah. Thank you for the questions. This is very important questions in order to be able to practice in a country. At this point in time, IMU dental degree is recognized by the Malaysian Dental Council. It's not recognized by other dental other countries' council. So we are in the midst of applying for the Sri Lanka Medical Council's recognition. So, but if you wish to sit for exam in other countries to obtain permit to practice in other countries, we do have support for you to do so. In fact, quite a number of our alumni, after obtaining our IMU dental program, they have gone on to sit for the professional exam in other countries like in UK, in Hong Kong, and they managed to pass it, no issue at all. Because in IMU, our training is very comprehensive in terms of knowledge and also in terms of clinical skills as well. So they are well prepared to take the exam of other dental councils in other countries. So we do have our alumni channel that how these students prepare for the program, I mean the dental council's exam to be able to practice there. So we are happy to give you such support.
Thank you, Prof. Another question, we have a lot of questions today. So another question is, do we have to transfer to other states like Batupat, etc., like the IMU Medicine Pathway?
Yeah, for the dental program in year 3, we have a module called human disease. So this is a very important component for the dental program to learn about medicine and surgery. So we do have posting to our IMU medical campus in Seremban Hospital. So we do have a block of postings. The block of posting generally is for 2 weeks. So they will be posted to the hospital to learn about medicine and surgery. Apart from that, in other modules in the dental program, for example, the oral surgery component, they also go down to Seremban to see other case mix. So this is to enable students to have wider exposures to other dentally related cases as well, so that they will have good grasp of the knowledge and also have personally seen all these patients.
Right. Yes. Thank you, Prof. So I'll take another one. Is hostel provided?
We do have a hostel that is managed by IMU, which is in the vicinity of the campus. So yeah, it's like a few minutes walk away from the main campus. And right, they are situated in a very nice flats. So we do have some flats that we manage that students can live in.
Right, right. So we do have that facility for the outside students to have an option to stay in a hostel. The other one is, I think the person has missed out your slide about what are the partner dental schools in other countries.
Oh, at the
Yeah,
moment,
yeah.
we have partner schools in 4 countries. We have partner schools in Australia, that is University of Adelaide. We have partner school in New Zealand, in University of Otago. We have 2 partner schools in UK. We have University of Dundee and University of Glasgow. And we also have 1 partner dental school in Canada, University of Dalhousie. So we are also in the midst of talking to University of Liverpool in England. So next year they will come on board for our partner dental school track. So from next year onwards, you can choose to go to University of Liverpool as well.
Okay, that's great. So we do have this a number of partner dental schools where you can choose to go another next 2.5 years of sessions, 2.5 years to 3 years of your part of number of years from your BDS program. Thank you, Prof, for answering this question. We have one question about, let's say if I take my A2 level in October, November, but I already have my AS level results, will I still be able to apply in February?
Okay, Marcella, thank you for the questions. So our intake, as you know, our intake is always in February. So each year we only have 1 intake a year, which is end of February. So the application is ongoing. We can give you conditional offer with your forecast result, but at the point of you entering, you need to have real results. So previously we do able to give forecast results offer, but now the government has stated that you need to have your actual results in order to secure the offer. So if you are able to obtain your A2 results, say in January, you can still apply to us because the application is ongoing process. We do not have a closing date, so-called, for the application.
Yep.
Okay. So do get in touch with us if you are not sure when will you get your actual results. We can assist you in the application process.
Right. Yeah. So yeah, there are a few more questions, the same on the scholarship of dentistry, which Prof has already answered this question. And if you would like to know more about it, we can give you a link further towards the end of this program later on. Yeah. Thank you so much. I would also like to ask Prof that how the School of Dentistry is managing or tackling when students are coming back to the school now. Maybe if they have been permitted to come back to the clinics or practical sessions, what are the things which school is arranging on the university level or school level?
Yeah. Okay. Thank you, Praveen. This is a very pertinent questions, especially during this pandemic, to ensure patient safety and adhering to the authorities' guideline. We do follow the Ministry of Education's guideline, and Ministry of Education's guideline has stated that for special in area or special needs for learning, for example, students need to provide patient treatment, and students need special equipment to learn to obtain their practical skills, they are allowed to come back to the campus. So in IMU, we have limit the amount of students that can come back. So we have staggered the number of students who can come back amongst the program. So because we are small program, most of our final year, well, in fact, the whole cohort, our final year has come back. So we also observe very strict SOP as well. As mentioned, our SOP is based on the guidelines by Center for Disease Control and also by the Ministry of Health guidelines as well. So we have to take strict measures to ensure that our students are safe, the patients are safe, and also the clinical supervisors are safe. So whenever they come in, they will need to scan the MySejahtera app, and they also need to don all the full PPE. And as mentioned, we also have special aerosol generating procedures bay to ensure that the aerosols that is generated from patient's treatment doesn't get out to other general areas. They are all confined and being disinfected. So
Right.
these are special measures that we have put in place to ensure students are safe to come back.
Yep. Right. Thank you, Prof. There is one more question on any maxillofacial training in Malaysia after graduation from the IMU. I think student is it a
Yes.
maxillofacial surgery? I understand.
I think maybe the person is asking for postgraduate training.
Postgraduate. Right.
Yes, we do have maxillofacial training in Malaysia after you obtain the basic dental degree. So generally, after obtaining the dental degree, they would require to have at least 2 years of minimum clinical exposure and clinical skills first prior to specialization. So at this point in time, University of Malaya, UKM do have maxillofacial training, postgraduate training. At this point in time in Malaysia, to be recognized as a specialist in this country, you need to undergo 4 years of postgraduate training, meaning to say the program needs to be 4 years. So all this specializing training is all a 4-year program.
Right. Yes. And to add to Prof. Shah's question, we do have our own IMU's 1-year diploma program as well.
Yes.
In clinical dentistry, in endodontics, in prosthodontics, and implant dentistry, which is in a way it's a bit of like a flexible program for private practitioners, and that also you can think of anytime. So thank you, Prof, for answering this question.
Yeah.
I will take another question about some students in some countries are unable to sit for the actual A level, and thus they will be awarded grades based on the evidence provided by the school to the examination board. Will these predicted results carry the same weight as entry requirements as the results from the actual exam? A bit tricky, yeah.
Yeah, thank you. At this point in time, we do understand the actual exam may not be conducted. So if it is a formal recognition of the results by the IGCSE board, we will recognize it. But I think best is you talk to one of our counselor to clarify what sort of predictive results you have. We may need to have a look at the predictive results that you have to advise you further on this. So I will put up the QR code and the link for you to chat on a one-to-one basis with one of our counselor, so that we can give you further advice whether we are able to accept this predictive result or not.
Right. Yep. Thank you, Prof. I think someone has written the question in chat box, but I'll take that question as well. The students returning from the partner university required to sit for professional qualifying agency exam?
Okay. Yeah, this is very pertinent questions and very important, because next year from 1st January 2022 onwards, we are rolling out our dental act, a new dental act. Our old dental act has been in place since 1971. So in 2018, we have revised our dental act. So it's our dental act 2018 that has been passed in the parliament and will be rolled out in 1st of January 2022. So whoever that come back from overseas will have to sit for this, we call it a PQE examination, professional qualifying examination. So even if you are in IMU for 2.5 years, if you go to overseas and you return, you will need to sit for the PQE exam in order to be able to practice as a dentist in this country. But for all the local universities, it has been agreed at the council level that the schools will adapt all the PQE exam in our own school curriculum examination. So whoever that qualified locally from the 13 dental schools we have do not need to sit for the PQE exam. However, if you come back from overseas, then you will need to sit for the PQE examination.
Right, correct. Yep. Thank you, Prof. It is a well-explained question now. Thank you so much.
Our counselor to find out the exact entry requirement for different exams that you are going to sit for, or different pre-U qualifications that you have with us. We also have published in the website, we have our brochures that clearly spell out all the entry requirements to the dental program.
Yes. Yes, Prof. I think I've almost answered all the questions by the participants.
Yeah.
And yeah, we are almost towards the end of the this live talk now. Probably you want to share the link and the QR code for the students.
Before I share, I would also like to emphasize that to enter into the dental program, the whole process is you send an application to us. We will look at your results. If you fulfill the entry requirement, we also will conduct a interview session as well to for the student selection. So once again, I would like to thank all of you for coming in and show your interest in joining us in this journey for your career path as well. Yeah. Stay safe, everyone.
Thank you so much, Prof, for your very simply described explanations for all those questions, and we tried to actually answer all the questions by the participants, I guess. And with this, I would like to close this session, this live session today. Thank you so much, everyone. Thank you so much, Prof. Seow, and do take care, everyone. Bye bye.
Yeah.
See you soon.
Thank you, and stay safe.